Coming up on Paramedics Emergency Response.
Take off your shirt. Let me see where you're... This patient has 6 or 7 stab wounds. Dude, take your shirt off.
Were you intentionally trying to hurt yourself?
Because you don't accidentally take 30 of anything, and I'm concerned that she's tried to harm herself tonight.
Did you get knocked out?
My name is Cornelius. I've been on the streets of Saskatoon for 35 years.
Like, do you sleep well every night? I feel like when you stop, right?
I haven't
like,
slept since
1994.
2004.
Do you have bad dreams?
No, I haven't dreamed in years.
Do you deal with like the stuff that you see, like you don't think about it at home anymore?
No. See, I don't know. I used to be able to drive home.
Based in 1967, you're responding for a 20-year-old male involved in an altercation. To the hand.
The call comes in, single patient stabbed to the hand.
It says assailant's gone, location unknown.
However, in my experience as a paramedic, if someone's been stabbed in their hand, there's a possibility that they've been stabbed elsewhere as well.
Tell them we're 21.
1967 is 21. That's him there?
You got
Okay.
back twice.
Take off your shirt. Let me see where you're... Take off your shirt. Dude, take your shirt off. I got one left flank. Take this right off. I know right away when I see this patient that he requires an ambulance all to himself. We need another truck. 1967 to base, send us another truck, Bravo, 2 patients in the box. This patient has 6 or 7 wounds within the box. We would call this area the box. The potential for life-threatening injury is high. Come with me to the ambulance.
We're gonna get another ambulance here.
My patient is quite agitated.
Yeah, his buttock. And his shoulder.
He's got a wound to his leg, nothing that seems life-threatening.
It's this leg, right?
Did you see what happened?
No, I didn't see what happened. We were just driving by, and then I just seen these two screaming and yelling for the cops and the ambulance.
Corey, where is he? Corey.
Brooke, we won't be here long.
How many stars have they got?
So this is a good example of a distracting injury where the patient is focusing on the injuries that he can see. You've been stabbed a bunch, eh? What kind of knife, do you know? That he's completely not even aware of the injuries to his back. 1, 2.
Maybe just grab a scoop and a blanket and we'll just get him ready for the next truck because he won't stand up on that leg.
That's so easy.
Just stop talking for a minute. 1, 2, 3, 4. Sit up again. 5, 6.
Do you have any medical conditions? You don't take medicine for anything?
I want to die! Bad!
So there's a lot of adrenaline, anxiety, and fear with this patient. So he's doing a lot of talking, but he's not really saying much. Up. I'm trying to focus on my assessment. We're just checking your blood pressure here, okay? My biggest concern right now is that one of these punctures in his chest has gone through his lung. And so if he starts becoming agitated and hypoxic, just be calm, just be calm. I might have to stick a needle in his chest.
Like my lung hurts really bad, man.
We're gonna take him to the hospital, okay?
But this fucking weird feeling in my chest right here.
Stop talking and just focus on your breathing.
Do you wanna help these guys and I'll go make sure Corey's doing okay?
Sure. We need to go. So 6 total, 2 in the back, 1 in the left chest, the other ones are in the arms. His vital signs are stable right now, but my concern is 2 minutes, 3 minutes, 8 minutes from now, he could start decompensating. Don't panic. You're the sickest person there. You need to calm down, okay? We're getting these patients to the hospital, and city police will be on the lookout for the assailants. Hopefully we don't have any more stabbing victims tonight.
Year-old male assaulted, happened now, assailant gone, not armed, serious bleeding. Oh. Serious bleeding. All right. Head injury.
Injured head or head injury?
Dispatch tells us we have a male patient with a head injury. This could mean he has a simple cut to his head or a very serious brain injury.
Patient has back of the head injury.
Okay. As we approach, we see a man walking out to us. We assume that's our patient. He looks to be okay, but we don't know the extent of his injuries.
Hi there, sir. What's your name?
I didn't call the cops.
No, I said, what's your name?
The patient's response to my first question doesn't really make sense. This could indicate a serious head injury.
Let's check you out, okay? Come this way. Come sit down, okay? He looks distracted. He's got blood all over his face. We want to get him in the back and get a better look at his injuries.
All right, Joseph, so what happened tonight?
Got kicked in the face, back of my head.
I'm just gonna check your back quick, okay? Did you fall?
Yeah.
Lean back, I'm gonna check your chest and your tummy, okay?
The bleeding to the back of the patient's head might be a distracting injury.
How long ago did this happen?
We need to check and make sure there isn't any other trauma.
20 minutes ago?
15, 20 minutes.
Okay.
The patient describes being kicked and punched in the head. We have to be on the lookout for symptoms of bleeding in the brain.
Any pain when you nod your head up and down?
No,
Did you get knocked out?
no.
No, you remember everything that happened?
Yeah.
It's sad when we see this situation. We find people living on the street, vulnerable people.
My name is Cornelius Valentine. I've been on the streets of Saskatoon for 35 years.
And they end up becoming a victim of a violent crime. I got it.
So just on the back of the head you got hurt, is that right?
Yeah.
It's hard enough to think about this patient living on the streets for 35 years,
Two guys, that one guy tried to stop him, couldn't make it.
let alone being randomly assaulted by a group of people in what appears to be a case of mistaken identity.
They thought I robbed a lady.
Well, it looks like Cornelius was in the wrong place at the wrong time. He doesn't even really know what happened. And I think he got jumped by a few people all at once. And it was, I think, out of the blue and caught him by surprise. And then he just kind of hightailed it out of there and tried to get some help. So we're going to go take him to the hospital and check him out.
Base to 67.
Calling Delta for 35-year-old female taking accidental overdose on gabapentin and methadone.
Next one. So accidental overdose is a call that we frequently go to. It should be this one here. The reasons for the accidental overdose vary. Sometimes people misunderstand the instructions or the doses. So my side of the street. Sometimes they have a lapse in judgment. Initially they want to harm themselves, take the medicine, and then decide that they don't want to harm themselves. Could be where those headlights are.
God, those lights are bright, eh?
Both methadone and gabapentin are fairly commonly prescribed and also fairly commonly abused.
She's fading out right now.
Yeah.
The patient appears unconscious, but we can't get to her because her friend is in the way.
No, you're at home and
She is on methadone?
she took her daily methadone and then she took Gabby's.
This patient's friend is frantic.
Okay, maybe we'll just get out of the way.
Can you come back? We need to move her away from the patient so that we can start treating her.
We have to help her. We have to help her. Up you get.
I understand she's concerned for her friend, but I need to get to the patient.
Don't worry.
I've got a radial.
She's gonna be okay, don't worry.
She's breathing.
Tell me what's going on with her today.
She started, she went to the bathroom, right? And she started banging into the walls and then she took more down.
Narcotics are our biggest concern when it comes to drug overdoses.
Eyes of pupils are big.
Because they can affect your respiratory rate, which can kill you a lot faster than anything else.
Yeah, her respirate's fine too. It's not narcotic.
I use painful stimulation in the form of a sternal rub.
Wake up, hun.
And the patient starts to wake up.
2, 3.
Use your legs.
Okay, and how did she come outside then, you guys?
Did you take more gabapentin than normal? When the patient tells us that she's taken 30 gabapentin pills,
were you intentionally trying to hurt yourself?
I start to question her intent because you don't accidentally take 30 of anything, and I'm concerned that she's tried to harm herself tonight.
I'm not perfect, but this is my best friend.
And you know what? You guys are looking after your best friends, and that's all you can do, right?
There is a lot of people out tonight. It is. Wow, it's not even 2 in the morning.
10-4-073, Alpha response, 52-year-old female, feeling unwell.
They skipped the actual complaint. I feel like there's more to the story here that we're not, something they're not telling us.
The fact that dispatch wasn't given any information for this call may mean that the patient is simply embarrassed.
Hello. Hi. Hi. And what's the trouble tonight?
For a week and a half.
A week and a half?
Yeah.
Are you having any belly pain?
Well, yeah.
If this constipation goes untreated, it could lead to serious conditions like a bowel obstruction.
Is she on a lot of pain control?
Yeah.
Yeah. Then. Yeah, that can make you constipated. Do you? Yeah. Do you take like a stool softener with them?
No.
See, if you're on a lot of pain meds like those T3s and stuff like that, you need to be on a.
No, when I don't have them,
No.
I go like, well, actually, I go like that, yeah, but.
Say yes. Just say yes.
Sometimes family members can try a little too hard to help, and that makes it difficult to hear what the patient actually has to say.
We're very interested in what you have to say about your body. Okay. Should we take you to the hospital? Okay. Should we take you to the hospital, hey?
That's how her mom died.
Okay.
He couldn't pass in the stool, right?
I understand, sir.
And she dies like that.
That's really scary.
The family member's past experiences are making him perceive the situation to be more serious than it might actually be.
Do you guys want to go to St. Paul's?
Yeah. I want you to take her to the hospital, get her seen by a doctor.
This patient's pain has been growing for 10 days. She needs to go to the hospital. It needs to be investigated and treated as soon as possible.
Okay, can you turn and sit here? There we go.
The patient's diagnosis seems pretty clear.
It's okay. He'll be right behind us.
But we need to take her to the hospital so she can have it investigated and treated.
Morning base, 1967 is 10 from 81.
You get so mad about everything.
Corey's one of my favorite people to work with. I feel like we work together well because I was his student.
5210-4.
So he was able to train me the way he wants things done.
I don't get necessarily mad. I just have a
Yeah. It's
and then I get over it pretty quick.
I think that he expects a lot, which I appreciate because I want to be held to a higher standard as well.
It reminds me always of that cat that was scratching at your new boots.
So if before Corey asked me to put the 12 lead on, I'm already doing it. Before he wants to push a drug, I've already drawn it up. That all comes from good training, and my basis of my training is from him.
Base to 1967. You're responding for a 2-vehicle NVC. 1 vehicle is smoking. No reports of entrapment. No chemicals.
You copy that.
The call comes in, it's a 2-vehicle NVC.
Circle Drive and Laurier.
At a pretty major intersection, so there could be serious injuries.
Ooh, they hit the whole post.
We pull up on scene. It looks pretty bad. There's 2 vehicles that have significant damage. A traffic light is down.
I don't think there's any power lines down.
Fire's on scene first. They're gonna make sure it's safe and triage the patients. Hey guys.
Hey,
what's up?
I think the more serious over here, missing to the big shaking up.
Good, how are you?
This is Jake.
How fast were you going, Jake? You're just turning, okay.
So this guy behind here was taking a left turn. He had the green arrow, and then the lady in the truck had blown the red light and sloped him, and then he did a full 180.
He can probably stand and pivot, you think?
I've cleared the patient's C-spine by the time Corey gets back with the stretcher, so we're okay to move the patient out of the car.
I think so. He's not going to have any neck or back pain.
Okay.
Just take your time. Any pain in your neck? Okay.
Just nice and high here.
The occupants of the car are a grandfather and grandson who were just on their way back from the hockey game.
We're gonna slip this jacket off before you lay down, okay?
With high impact collisions like this one, I'm looking for possible spinal injury, possible head injury.
Do you have any allergies, Jake?
some drug allergies, yeah.
Okay. As well as internal issues like a bruised heart or bruised lungs.
What's your grandson's name?
Wyatt.
Wyatt, okay. I'll go get him once we get you in the ambulance. I'm going to get his grandson too, and then they can be together here. There's lots of damage to the vehicles. There's a traffic light down and debris all over the road.
She'd like to talk to you guys just to get checked out a little bit.
Okay. These people are lucky that their injuries aren't worse. I just want to check your neck and your back here. Just keep your head nice and straight. You let me know if you have any pain where I'm touching, okay? Talking to the driver of the other vehicle. When you turn your head left to right, no pain? Physically, she's uninjured? No. Good. Okay. But she's a little bit shaken up and concerned about the welfare of the other people involved.
Was that other person gonna be?
Yes, everybody's gonna be okay.
Any accident at or near highway speeds has the potential to be very, very serious. The young man that was in the passenger side of the car,
How you doing?
I'm good.
Do you want to come see your grandpa?
was very lucky. If the vehicle would have been any more in the intersection, it would have impacted right where he was sitting.
How are you feeling right now?
Good.
Although it's a serious accident, it's lucky somebody wasn't more seriously hurt.
Maybe. Hey, Wyatt.
Hello. You want me to let Grandma know, Gramps?
Phone your mom first, please.
Okay, so we're gonna check your vital signs, and then, yeah, I'll put some more bandages on that guy. So what do you have for medical history?
Medical history?
While I'm treating the grandfather,
Hey, Mom.
it's impossible to not notice how amazing this grandkid is handling the whole situation.
It's all good. Everything's okay, but me and Grandpa were in a car accident. We're in the back of the ambulance. We're going to the hospital. Grandpa's okay. We're both okay.
The grandfather's pretty proud of his grandson,
If it means anything, we lost, but I scored one.
both with how he's handling the situation and how he did in the hockey game earlier tonight.
Attaboy.
It's okay, don't worry. I will. Anything I know, you'll be the first one to know. Okay. No, I slept in the worst place.
Pretty mature for a 14-year-old.
It's an awesome kid.
Okay.
Kind of had a tough night tonight. We seen a drug overdose.
How you feeling, Grandpa?
It's refreshing to see such a nice relationship between a grandpa and his grandson. We need another truck. 1967 to base, send us another truck, Bravo, 2 patients in the box.
Okay.
Regarding the call at the beginning of the night with the 2 men that were stabbed.
It's this leg, right?
Yeah.
Brooke, we won't be here long. Both the men were transported to hospital where they received treatment and were later released.
Lean back, I'm gonna check your chest and your tummy, okay?
Regarding the patient who had an injury to the back of the head,
He was held through the night and released the next morning. He says he doesn't remember much that night or what happened, but he says he's doing much better now.
On the call with the girl who overdosed on methadone and gabapentin. Eyes, pupils are big.
Yeah, her respirate's fine too.
She says she doesn't remember much of the night it happened. She was on meth and took 15 of her gabapentin pills because she felt suicidal. She takes gabapentin for the diabetic pain in her legs. She says she's feeling better now. Regarding the car crash tonight, Jake received 12 stitches in his left hand.
Everything's okay, but me and Grandpa were in a car.
He says he's very proud of his grandson Wyatt for taking such good care of him that night. He's also grateful for the good treatment from all the medical staff, and Wyatt says he now wants to become a firefighter or paramedic.